And I say this because it has taken more than 2 years being on the streets. And you know, it is really embarrassing for a nation to have its health workers on the streets, other than having workers in the hospitals alleviating the suffering of patients and assuring Kenyans of their health. But now they seem to want to even prolong this situation. We fought for the allocation of the 8.9 billion for the absorption of the universal health coverage staff, and as well as the global health staff. This matter has been addressed to the highest office. We have seen the President, His Excellency, Dr. William Samoei Ruto, come out on 2 occasions assuring the universal health coverage staff of their job security from July 1st of 2026. But we are really taken aback when now the Council of Governors is coming out to inform Kenyans that they can only give a 1-year contract to these workers. These workers have been subjected to more than 2 contracts, I think about 4 contracts over 6 years, that flies on the face of our Constitution in terms of discrimination and goes against the Public Service Commission Act that makes it mandatory for absorption of any staff after their contract has been renewed once. So the government has already contravened the rights of the universal health care workers and the Global Fund staff. And the simple thing that we had asked and had agreed, and we really thought that we were through with this, was that they be given permanent and pensionable status, and this be done in a sustainable manner. But our apprehension is on how this money is being allocated. When you allocate money under conditional grants, it means that that money is only being allocated for that particular financial year and not a recurrent expenditure. And we all know that the emoluments for this staff is something that is recurrent, because once they are on permanent, they are there perpetually. And so, the reason as to why we are here today is, number one, to say that it is very unfortunate to prolong the suffering of the UHC and Global Fund staff. And number two, to ask in no uncertain terms that the Parliament, the National Assembly and the Senate must sit and reconsider and allocate this money through the Division of Revenue Act to ensure its sustainability beyond this financial year. And of course, if this does not happen, we are very much prepared. We were on the streets. We are not tired. We will go back to the streets. And this we are doing starting this week, going forward until that happens. But if the demonstrations are not going to work, then we shall all jointly as unions go on strike as from 1st of July 2026. But allow me to invite the General Secretary for KEFPU so that he can read the detailed press statement, and then we are going to have my comrades, my brothers and sisters who we are with here to also give remarks to the same effect.
Thank you. Comrades, power.
Power.
Public health, hoye.
Hoye.
Health workers, hoye.
Hoye.
Thank you so much, Honorable Chair of the caucus, Mr. Peterson of Ashira. My name is Brown Ashira. I'm the General Secretary for the Public Health Union. I'll go straight and read the statement. That is a joint statement between the Health Union Caucus on the absorption of UHC and Global Fund staff to permanent and pensionable terms. We, the Health Union Caucus, comprising of Clinical Officers Union, the Kenyan Environmental Health and Public Health Practitioners Union, the Kenya National Union of Nurses and Midwives, Kenya National Union of Medical Laboratory Officers, the Kenya National Union of Nutritionists and Dietitians, the Kenya National Union of Pharmaceutical Technologists, and the Kenya Medical Practitioners, Pharmacists and Dentists Union convened an urgent meeting to address the continued injustices facing the healthcare workers, particularly the Universal Health Coverage, UHC, and Global Fund staff who have not yet been absorbed into permanent and pensionable status. With only 2 weeks remaining before the expiry of their UHC contracts, healthcare workers are experiencing heightened anxiety and frustrations, having waited for the issuance of PNP appointment letters, which to date have not been released. This uncertainty has caused immense distress among the affected workers and their families. We note that in the 2026-2027 budget estimates approved by the Parliament, cash to 8.9 billion has been allocated under conditional grants for the payment of salaries for UHC staff for 1 year. While this allocation is appreciated, it does not provide sustainable solution to the long-standing issues of employment insecurity facing the UHC and Global Fund workers. In light of the foregoing, therefore, Health Union Caucus demands the following. 1. Immediate absorption of all the UHC and Global Fund staff into permanent and pensionable terms and issuance of appointment letters by 30th of June 2026. Number 2, Parliament to include the allocated funds through equitable share frameworks rather than annual conditional grants, which are unsustainable and continue to expose UHC and Global Fund workers to uncertainty and job insecurities. And then number 3, the Health Union Caucus to be actively involved in engagements regarding the transition process of the UHC and Global Fund workers into PNP terms. Failure to address the foregoing demands above, all the unions represented in this caucus shall, number 1, proceed to industrial action without further delay to demand for full transition into permanent and pensionable terms for all the UHC members as agreed by 1st of July 2026. Then number 2 is that we shall mobilize all the members to to demonstrate and pitch camp at the National Assembly and the Senate until the required resources have been allocated as equitable share under the DORA. DORA is Division of Revenue Act. In conclusion, we urge the National Assembly, the Senate, the National Treasury, the Cabinet Secretary for Health, and the Council of Governors, that is COG, to urgently consider these demands and work collaboratively towards providing a lasting solution to the plight of UHC and Global Fund workers. Further, we urge His Excellency the President, Dr. William Samoei Ruto, to intervene and ensure that the jobs of UHC and Global Fund workers are secure to ensure achievement of a WENE plan and by extension universal health coverage. Lastly, the Health Union Caucus remains committed and open to constructive dialogue and engagement with all relevant stakeholders to ensure successful absorption of UHC and Global Fund workers and strengthening of the Kenyans' healthcare system for the benefits of all citizens. Comrades, power. Power. That is the statement.
Thank you.
Comrades, power.
Power.
Comrades, power.
Power.
I am Odipo Nicholas, the National Chairman, Kenya National Union of Medical Lab Officers. Now, just to add on top of what has been read and said, that as a country, we need to get serious, because we cannot talk of big ambitions such as WENE, achieving universal health coverage, and yet the people who are supposed to help the government achieve these are being tossed left, right, and center. In this scenario of UHC, we don't know who is fooling who. Because the money has been allocated, but it has not been allocated as an equitable share for the counties, but as a grant. And we agree that for sustainability beyond 2026-2027, this money has to be allocated through equitable share and not as conditional grant. So we want to ask the National Assembly and the Senate to urgently amend ways through this money is going to be given to counties through equitable share. Because then, if that does not happen, then they should tell us what will happen to UHC's staff beyond 2027. Considering that 2027 will be an electioneering year, and we are not going to accept that. These are people who have served this country diligently, and their continued stay in contract is injustice to them. So we are very straightforward today that all arms of government, that is the executive and the parliament, the legislature, must get serious with this matter of UHC. Secondly is the issue of Global Fund. They must get serious because we cannot have people continuing to work without pay. People have been working for close to 25, 26 months without pay. The Ministry of Health has kept these people at work, telling them that they are dealing with their matter. The question we are asking is, how long does it take the Ministry of Health to resolve a matter of 112 workers? How long? The Cabinet Secretary for Health need to answer us. How long does it take to resolve a matter of 112 workers? If it takes 26 months without a solution, how is he going to provide solution for over 55 million Kenyans? What I'm saying is that we need to get serious as a country. Because some of these things we are saying, then they will just be talk. Asante sana.
Let's have note. Then we have
thank you. Lady. Thank you, everybody. I'm called Kenneth Omog. I'm the chairman, Kenya National Union of Pharmaceutical Technologists. I wish to reiterate what our colleagues have said here loud and clear, that the issue especially of UHC workers has been a song that has been sung for far too long. And indeed, if a song is sung for far too long, it's no longer entertaining. It gets boring and nobody ever wants to listen to it. We want to ask the budgetary team to ensure that we are asking for equitable share, something that is sustainable to these particular colleagues, because they do the same work just as the other people who are on PNP and taken care of fully by the same government. We cannot keep asking that we want to improve healthcare system in this country when the software of that particular system you do not take care of. We can only do that if you first of all start by taking care of those who provide those services. Healthcare system starts with the people who offer that particular healthcare. Thank you.
Thank you, Lillian.
Comrades, power. My name is Lillian Mumina. I am the National Treasurer of the Kenya Union of Nutritionists and Dietitians. Mine is just to echo what my comrades have said. And the President, through the executive, they gave us, they've shown goodwill for Kenyans, you know. And next year being an election year, we tend to wonder if his government and his people actually want him to work. Because as a matter of fact, we cannot have UHC workers on contractual agreements that are illegal. The other day I was talking to a comrade and they were like, but the president gave a directive. It cannot be possible. You cannot have contracts. But we have seen that that is exactly what they are offering our people. And you tend to wonder, how are they going to, the emotional burden, the stress that they are putting their families and everyone that is associated with these workers on. So I urge that the National Assembly take these matters seriously, and if they want to be seen or they want to show Kenyans that they have the goodwill of the Kenyan people at heart, they should actually solve this issue once and for all. Thank you.
Thank you. Lastly, Kainan.
Comrades, power. Power. Now, my name is Stephen Rotere from representing the Kenya National Union of Nurses and Midwives. Now, without repeating what my colleagues have said, and which we are in total concurrence as Nurses Union of the entire country, is just to reaffirm that if by 30th of this month the letters are not issued to every universal health coverage staff, we shall do what our business is. We shall fill the streets. We shall make sure that all health facilities are closed. We shall involve all our staff, including those already in PNP, to give us support and leave the Ministry of Health to handle the patients in the wards. Otherwise, this issue has been long-standing and we cannot fathom or condone the act of delay anymore. Thank you.
Asante. Munataka Kiswahili ama hiyo imetosha? Thank you. Mko sawa? Hiyo iko sawa? Haya. Kuna maswali? That is the ban on the countries under high risk. Well, my take, not as the caucus but as Peterson Washira, is that we cannot probably be able to tell what other countries are going to do. But what people must know is that if you look at the international health regulations, if you look at the categorization when it comes to a public health emergency of international concern, then you will understand that Kenya is one of the countries that must be ranked as a high-risk country. And that is because we have communication in terms of our trade network, our road network. We do business with the people from where the disease is endemic, and that means that by default, then it becomes a high-risk area. So about the decision, I really think that it's a rash decision, because in Kenya we don't have any case. Probably it would have come if we had any case. But for now we don't have any case. And then those countries cannot impute something that is not already with us. And therefore it is unfortunate it is uncalled for and it's something that should not happen. But again, I think that is the work of the Foreign Affairs and the people concerned with that. We as the health workers, ours is to ensure that our people are safe. And I think that is what we are trying to do by saying that we have staff called Universal Health Coverage staff and the Global Fund staff who have very good knowledge about infectious diseases. They have a lot of experience from COVID-19 and they will come in handy in case we have a case of Ebola in Kenya. In case we have Ebola in Kenya, we will rely on people who already have that experience. And that is why we are trying to tell the government that they cannot toy with them. They must ensure that their jobs are secured so that we ensure we do not get more of those bans. If we don't secure the jobs of UHC and Ebola lands here when they're on the streets, probably we are going to have a further community spread and we'll even get more bans from other countries. So there is something we can do, and that starts with, can we first ensure that all our workers are secured, they are well motivated to ensure that they handle the situation. Thank you.
You can sing.
Want us to sing again? Tuimbe tena. Haya.
Mimi najua bwana. I'm there with the media. Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong. We shall never be divided, we shall never be divided. We shall never be divided, for the union makes us strong. Viva health workers, viva! Viva! Viva Kuko, viva! Viva! Viva KMPDU, viva! Viva! Viva NAPET, viva! Viva! Viva Kenam, viva! Viva! Viva Kefu, viva! Viva! Thank you.
Asante sana.
Viva katibu, viva!
Wakikuyu. Haya, wale watu wanataka local languages pia waseme, watu wasiende.